Hi, everyone. It's a pleasure to be here and provide this talk about hospital care in the future. My name is Dr. Eyal Zimlichman. I'm the Chief Medical Officer and Chief Innovation Officer at Sheba Medical Center and the founder and director of Ark. And I will take you through how we see the future hospitals being designed and a couple of examples of what we're doing these days to try to promote that vision. So obviously, starting with the setting, as we understand, drastic changes in healthcare practices are inevitable. It's not a question of whether these changes will happen, but only when and how soon. The problems are quite extensive, from the cost of healthcare to problems with quality and patient safety. We're not patient-centric enough. All of these challenges actually require pretty much a complete redesign. And hospitals will be one of the first to go through this full redesign. There are many reasons why, but if you think about it, hospitals actually account for most of the cost in the healthcare system. We take care of the most expensive patients, the most complex patients, and many of the problems in quality and patient safety actually happen in hospitals, like hospital infections, for example. So it's evident why hospitals will be one of the first to go through this redesign, and indeed it is a current necessity. Now, forward-thinking hospitals need to have a plan. How do we continue to lead? How do we continue to being forward-thinking hospitals 10 years from now, rather than wait and see how things evolve? And this is exactly what we've done at Sheba Medical Center. A couple of years ago in 2018, we decided to bring together a selected group of healthcare leaders from leading hospitals around the world to what we call the Summit of the Hospital of the Future, and really bringing people from the leading hospitals. You see here, we got together in October 2018, just about 3 years ago, and really a fine group of leading hospitals like Stanford and Johns Hopkins and Brigham and Women's in Boston and the Henry Ford and Thomas Jefferson and others, just in the US, but also many of them from Europe and other locations. About 30 of them actually showed up, and we had 2 days of roundtable discussions around how will the hospital of the future need to look like. How can we make sure we're building a hospital today that would still be relevant 10, 20, 30 years from now? Obviously, it's a challenging question. We then met again in Montreal a year later, a larger group, as you see here on the right side of the slide, in 2019, just before COVID hit, and continued the discussions for 2 more days of roundtable discussions. But later on, we took that idea not just to the future hospital, but to the future of health. And starting from 2020, when we had to go virtual like this event today, unfortunately, we expanded to look at the future of health, not just the hospital, understanding that the hospital is just part of a much larger ecosystem. And so we got a bigger group together, already about 40, 50 leading experts from around the world to continue the discussions. And this is an ongoing initiative that is getting together once a year to continue discussions around this topic. We looked at the data that we've gathered and basically have conducted qualitative analysis. As you would see, we had 3 researchers looking at all of the information. We recorded all of the discussions and then came up with insights into how we see the future hospital. So what are future trends in healthcare? And this is a very important slide to understand. As I've said, care at the hospital is very expensive, we know that, and care at the hospital is unsafe. Now, what's going to happen is that care will need to be pushed out from hospitals to the home. Now, this is already happening. It's not a recent trend. We're looking at the States from 1950 to today. The inpatient days per 1,000 population has gone down from about 900 to just over 600. But we think that over the next decade, we're probably going to see an even bigger drop in hospitalization days in the hospital. So this trend is going to intensify and become much more major as we look into the next few years. Now, digital health innovation is going to allow us to care for patients at home with the same intensity and the same acuity level that we treat patients at the hospital. Personalized medicine will help us prevent disease, and then, of course, if we fail to do that, only then go to cure and rehabilitation. But if we can prevent much of the acute events, again, there will be less need for hospitals in the future. So looking at all of this together, hospitals will become smaller with time, with fewer real beds and more virtual beds. I'll get back to that point later on. What is a virtual bed in a hospital? And hospitals will provide mostly intensive care, complex surgery, and specialized services. So hospitals in the future will become smaller, more specialized, treating higher acuity patients, while most of the patients that are today at the hospital will be taken care of at home. And we'll come back to that point. So when we talk about academic health systems of the future, health systems will provide the full spectrum of care, education and research across the continuum. Instead of just having an academic medical center, which is that leading hospital like Sheba Medical Center and other leading hospitals around the world, we will have an academic health system looking at, again, that patient across the continuum, not just in terms of clinical care, but also in terms of education to our staff, not only education happening in the hospital, but also education happening outside of the hospital. We'll have to see academic health system take full accountability over the full range of health, not just health care, but health as a general term, including social, education, healthy living, etc. Of course, prevention. All of that will be the accountability of academic health systems, looking at populations. Payment will be per capita. So we're being paid per population we're caring for. If we're caring for a population of 50,000 patients or 100,000 patients, we'll get paid double if we care for a population of 100. But again, taking full responsibility across health in general for that population we're caring from. And that's how payment will work, with value incentives to provide incentives to improve value for patients. Advances in telemedicine and artificial intelligence will improve care, also provided at rural hospitals. When we talk about hospitals that are not in the center of the country, but in the periphery, where we typically don't have the right or the optimal care team sometimes to care for those patients. Telemedicine and AI will help us care for those patients. So it will improve equity, reduce inequality in healthcare, and also allow us, again, to push treatment and care to the home. And most surgery actually will be pushed out to ambulatory surgical centers. So surgery that today takes 3 hours and is being performed in the hospital, 10 years from now will take 1 hour and will be performed in ambulatory surgical centers. So hospitals will continue to operate on the more complex surgeries. If you have to go through Whipple surgery, triple bypass, and so on, you will probably need to stay at the hospital to go through that surgery even 10 years from now. When we talk about research and innovation, leading hospitals will still lead the way in research, but we'll see a shift from basic science to clinical and translational science, which in other words means innovation. And so academic health systems will need to take the lead on innovation, creating innovation hubs. While today we see research hubs in hospitals, much of the research, of course, the basics research, will move to the universities or will remain in the universities, while the hospitals will focus on the clinical areas and on innovation. So innovation centers like Ark, which I'm going to explain to you in a few minutes what that is, are going to be transformational in terms of keeping leading hospitals still leading in the next decade. So what is the innovation that will enable this transformation? We've mentioned telehealth, and of course, we need a lot of innovation around telehealth. Artificial intelligence, we need a lot of innovation around that if we're going to see much of what I've talked about so far. Virtual reality, augmented reality, or extended reality as we call it, together with 3D printing, will play a major role on many, many ways. And finally, robotics will also play a critical role, whether these are robotics in the operating room, where we're talking about robotics in the future, not just being manipulated as they are today by the surgeons, but also having capabilities to perform some of the surgery and maybe in the future all of the surgery through AI, as we call autopilot, as we're seeing that in airplanes today. So surgical robots on autopilot will become something that will be used to in the future. All of that requires a lot of innovation, as you realize. And this is why at Sheba Medical Center, we've started ARK, our new concept for medical innovation. It stands for Accelerate Innovation to Redesign Healthcare through collaboration with partners. And I invite you all to come and visit and see ARK in your own eyes. And ARK is an ecosystem that will change the future of medicine, because that's exactly what we're setting out to do. It's based on 4 principles. The first one is prioritizing digital health, because if we're going to change healthcare over the next decade, then digital health will be the main transformation vehicle as we understand. Second, it's open innovation, working together with the industry, not us, public versus private, but public and private in partnership, working to redesign healthcare. Having startups play a major role in that, because much of the innovation is coming from startup companies. As you know, many of them are coming out of Israel, and Israel is a hotbed for startup companies, introducing them into the clinical environment, providing them everything they need to really accelerate innovation. International collaborations, looking internationally for the best partners, period, regardless of geography, because that is no longer a barrier when it comes to collaboration. And innovation infrastructure. What is the infrastructure needed to take innovation to the next level? Both physical, but also data infrastructure and policy and regulation and funding infrastructure. How can we fund innovation? As you know, that is very costly. We call the innovation infrastructure the Ark cookbook. It's a cookbook, quite a big one, that can be implemented in different areas in the world. And we're doing that actually in different countries, implementing the Ark methodologies, the Ark cookbook, the infrastructure in hospitals and also outside of hospitals. So the entire Ark network today is looking like this: more than 100 collaborators, members in the Ark ecosystem, from startup companies to corporate strategic partners. You can see the names here, to international collaborations, leading hospitals around the world. And you see some of the names here, from Mayo Clinic to Mount Sinai in New York, to Brigham and Women's and Mass General in Boston, and others. Also a couple in Europe, as you can see here, and the academia, leading academia here, universities in the country of Israel, where we work very closely with the academia here locally. All of this together is working to change the future of healthcare. It's not just Sheba alone that is Ark, but really a consortium of like-minded organizations that, first of all, draw that vision through the FOH community, as mentioned at the beginning of my talk, but then execute that vision through through Ark. And Ark is that innovation arm for FOH in many ways. So how do you transform innovation into value? Because at the end of the day, it's not just about coming up with an innovation you could commercialize and maybe make money. We also want to have an impact. We also want to create value. How can you transform innovation into value? You first need to identify the right technology for the problem that you're going to solve. You then need to set the clinical protocols in place. You then need to show evidence by piloting, of course, on small scale. You need to set a payment model, and then you have to go through a multi-site rollout. The idea at the end of the day is to have innovation play a major role in providing value to millions of patients. It's not such of a challenge to do that on a small scale when you're doing a small pilot in a hospital. The real challenge is implementing on a wide scale, and this is exactly what Ark is setting out to do. So how do we see this play out? For example, hybrid hospital model. I mentioned that before. You know, traditional hospitals, this is a photo from one of the Sheba corridors on a very busy winter day, when sometimes we have to put patients in the hallways because we're overflooded with patients, as you know, especially now through the COVID pandemic. But what we're already transitioning to is a hybrid model. And the hybrid model basically talks about virtual beds alongside physical beds. So think about a 36-unit bed unit, internal medicine, for example. And from the 36, 18 are physical metal beds, traditional, but the other 18 are virtual beds. They are basically beds at the home of the patient, but being managed clinically through that unit, so that when you're a doctor on that unit, you might go on a patient round that morning to physically see your patients, the 18 that are there physically, or you might do your rounds virtually through the screen, examining patients when at their home, making clinical decisions, and when the patient is well enough, discharging them from their virtual bed at home, or if they're not doing well enough, bring them into the hospital, into the physical bed. Now, this model, we think, is the model of the future. It will allow us to clear the hospitals and allow patients that really need the hospitals to come there, while other patients that are lower acuity can be treated at a hospital at home model. This would rely on the internal medicine doctors that know best how to treat patients. They are in the hospital, as you know. Nursing services provided by home services companies. It won't be the nursing from the hospital that leave the hospital, and the doctors would most of the time stay in the hospital to care through telemedicine. This would, of course, improve continuity of care, but also would allow hospital services like consulting services to be extended to the home. Now, how do you carry this out? You need to figure out the technology, what allows you to communicate with the patient, monitor with the patient, and perform physical examination of the patient at home. And you can see here some of the technology. I won't go through the names of the companies, but these are some of the technologies we're using in our hospital at home model. And you can see a couple of photos here of how this is actually being done. And at Sheba today, we have a virtual unit where some of the beds are physical and some of the beds, as I've mentioned, are at home. We also are doing psychiatric hospital at home, where we have psychiatric patients that are spend 24 hours in the hospital, excuse me. But then if we find that they're eligible, they go home and continue the whole psychiatric hospitalization at home. Remember, these are acute hospitalizations for psychiatric patients, but they pose no danger to themselves or to their environment. And so we realize that they can be hospitalized at home. And so hospitalizations at home can happen. And you see here an example of Dr. Asaf Kaspi, who's the head of one of our psychiatry units, caring for patients at home through telemedicine. The patient is then discharged, but we continue through accountable care. We continue to be accountable for those patients to complete 365 days in a bundled payment approach, where we're being paid per month per patient, and regardless of whether the patient is coming back or not, we have to carry that cost. If the patient is hospitalized, we won't be paid for another hospitalization, and that, of course, is critical for us to provide an incentive to try and keep patients outside of the hospital. Now, we're doing a lot of other stuff. I won't have time to go through all of that, but I do want to mention another big project that's going on right now at Sheba, and this is our control tower, where the idea is to use a lot of AI to run the hospital, run the patient flow, optimize clinical care, and run the logistics inside the hospital. And we're doing this again. We're finding the right companies, most of them startup companies, as you see here on this slide, to bring them into the mix and create this control tower. My aim at the end of the day is to have one nurse work with one tablet to run a 2,000-bed hospital like Sheba. And we think it's achievable with the right AI tools to do that. And this is exactly what we're currently building. It's a work in progress. It's going to take us at least another year and a half to finalize this project, but I think it's groundbreaking, and it will separate hospitals from smart hospitals of the future, who will be running on such tools, optimization tools, as needs to be. Now, the bottom line, and I have 3 hospitals here that have just recently built a new complex. You might know some of them, of course, Stanford, Erasmus in the Netherlands, and CHUM in Montreal in Canada. But they need to, they're part of our FOH group, and their CEOs are saying they were still built in the same fashion that hospitals were built all through the last 100 years. They're just more shiny, they're nicer, they're prettier. They need to be built a little bit different. So what do we need to do for academic medical centers to continue to lead 10 years from now? Build an academic health system. Look not only at the hospital, but look at the entire system through the continuum of care, and take accountability for your patients across the continuum. Embracing telehealth and hospital at home, which is critical to drive care from the hospital to the community. Adopting artificial intelligence, which will allow us to improve our decision-making for our clinicians and become much more efficient and effective. And explore non-traditional partnerships with other partners around the world, like Amazon and Google and others that are new players in this field, and provide more opportunities for us to reshape healthcare. This is where we need to go. And finally, lead through innovation, like Ark is doing. The leading hospitals, the leading academic health systems of the future will lead through innovation. And we call on the forward-thinking organizations of the world to join the FOH and to join Ark and reshape the future of healthcare. So I'll finish here. Thank you very much again for inviting me, and I wish you all a successful conference.